Well, I'm going to be sharing with you our COVID-19 planning assumptions and recommendations for the 21-22 school year. You're actually the first people to hear this. Next week, we'll probably release a slightly expanded version of these to try to give people a look ahead and some advanced notice that there are certain things that they should be getting ready for. So I just want to preface by saying that there's new guidance expected soon from the California Department of Public Health, and probably it will be out before June 15th. So some of the things that I'm going to present to you it might be slightly different based on how that guidance comes out. So here's my predictions about what the guidance will likely include. I think it's going to be heavy on recommendations and have very few actual requirements in it. Very likely it will also be much shorter guidance than we received in the past. I think it's fair to expect full classrooms. The governor and the legislature seem to want to have kids back in full-time in-person instruction as a default. Probably still have an option for parents that want or need to participate in some type of virtual option to be able to do that, but it'll probably not be, there probably won't be any hybrid. So I'm expecting full classrooms with no physical distancing requirements. I think in terms of face covers, we're likely to see different rules for unvaccinated students and vaccinated students, at least as far as the guidance is concerned. So right now, the guidance actually just changed, and it allows an unvaccinated student to not wear a mask outside, but they're required to wear it inside. I'm sorry, vaccinated students are allowed to not wear a mask outside but they're still required to wear it inside. Unvaccinated students are required to wear it inside and outside when physical distancing isn't possible. That's a bind for us as school leaders, because how do we tell which kids are vaccinated and which aren't? And then how do we protect both vaccinated students and unvaccinated students from harassment, intimidation, and discrimination based on their vaccination status? So as a practical matter, I think many schools may choose to just have one set of rules for all kids. I think next year it's likely, in terms of the guidance may permit unvaccinated students to not wear masks outside or inside. And that'll kind of shift the burden to school leaders to determine what the rules will be. It makes, from a political standpoint, then the state doesn't have to fight with anybody. Unfortunately, that gives us the fight. So with those things in mind, I want to walk you through our planning assumptions. The assumptions are reasonable based on what we know now, and anything could change and make them unreasonable, but based on the information that's available, I would consider these to be prudent for planning so that you're ready. It will be easier to walk back from these than it would be to create something new and catch up. The assumptions are focused on public health concerns and on likely impacts to school operations. The recommendations are focused on prevention and on mitigating impacts. It's not meant to be a crystal ball. It's not meant to be a set of predictions. It's basically, if we go forward with and nothing changes, these things will likely be true. So in terms of public health assumptions, COVID is not going away anytime soon. Community transmission rates and hospitalizations, ICU, the things that we were most concerned about are likely to stay low. However, COVID's going to continue to spread and mutate where unvaccinated people come into close contact. The Delta variant we're hearing is spreading across the globe right now. Very likely it will arrive in the United States sometime. COVID is an evolving threat. New variants continue to emerge and are likely to continue to emerge in places where transmission isn't impeded by vaccination. Some of those new variants could be more transmissible. They might have new or more severe symptoms. They may be able to evade the current vaccines, and they may not respond to current therapies. Our vaccines are super effective. but that effectiveness, it's not known really how long they will remain effective, that it may wane over time, and booster shots may be necessary at some point in the future. We already know many adults are going to refuse to be vaccinated, and it's likely that many parents will refuse to have their children vaccinated. COVID-19 is likely going to evolve into an endemic threat. It's just going to stay with us and have to be managed. Herd immunity isn't likely within the next 12 months. We're likely to see clusters and seasonal spikes as we attempt to get this virus under control. The other thing that isn't likely to change is that if it looks like COVID, we're going to have to treat it like it's COVID. So seasonal flu and common cold, which were suppressed last year by everything we did to prevent the spread of COVID-19, as we back off those prevention measures, very likely we're going to see more influenza and more colds. So with symptoms that are similar to COVID, this is going to contribute to employee absence and student absences, and it's going to increase the need for testing, particularly on-site testing and for isolation. So with those, I'll pause here for some questions. That was the assumptions on the public health assumptions. Do you have any questions right now?
I have a question about the masks.
Sure.
So let's say we're a charter school, we have our own LEA, and we decide that we want kids to be able to play outside without masks. Is that going to be like a choice or not a choice?
Well, as it stands right now, the guidance requires students to wear masks. It requires unvaccinated students to wear masks inside and outside. Outside, if physical distancing is possible, they could take them off, but kids at recess aren't likely to be able to aren't likely to physical distance on their own. So your responsibility would be to enforce masks unless the state guidance on face covers allows it. Next year, and unvaccinated students right now, vaccinated students right now can go mask-free outside. They have to wear them inside.
Right.
Next year, I think it's likely that unvaccinated students are still going to be required to wear masks inside and outside. That could change, but
kids, how come kids in sports don't have to wear masks outside now?
So sports are an activity that parents can opt their children into, or not have them participate. The guidance on sports actually says that participants are recommended that they wear masks even under heavy exertion, while they're playing, even under heavy exertion. But it's a recommendation as opposed to a requirement. Children are compelled by law to go to school on a daily basis. Parents can't opt them out of that requirement. So masks are required in schools, but they're only recommended for team sports, which are optional.
Okay, thank you.
You're welcome.
I have a follow-up question about the testing. What you said makes tons of sense, that it will be, because people will be having cold and flu symptoms when they are at school, it will be really good to have rapid COVID tests available on site. Is that what you hear from the districts? I know the county's supporting districts to do that. Do they seem to be planning in that direction right now?
I think there's a huge blind spot right now, and that's part of why I'm developing these planning assumptions. I think there's been so much emphasis on reopening the economy, and on June 15th, we're going to relax all the restrictions. I think many school leaders think that means that we're going back to normal, but it really will be anything but normal in schools. We're going to lose a lot of our prevention measures. We're going to see kids close to each other, but we're still going to have to respond to COVID-like symptoms. So it's my mission to get people to see it's not going to be that easy. If there's no question right now, I'm going to go forward with the next set of assumptions. So, I'm sorry. So in terms of school operations, we are not out of the woods yet. School operations are likely to be impacted by COVID-19 throughout the coming school year, with impacts greatest in areas that, of course, if you've got higher rates of transmission in your community, that's likely to be reflected on your campuses. Where vaccination rates are low, likely there'll be more transmission. And in schools that serve children who are too young to be vaccinated, very likely we'll see more transmission in those places because kids will be sitting close together. With that in mind, absent rates are likely to be much higher than their pre-pandemic norms. Full-time in-person instruction with minimal distancing and increased mixing is likely to result in increased transmission on campus, especially over like hybrid learning or distance learning. Movement away from physical distancing and stable grouping strategies is also likely to increase the number of close contacts that are associated with each case. So think about the way if kids were seated 6 feet apart, then there were no close contacts in that circle. Now we're seating kids 3 feet apart, and that means there are probably 4 contacts, close contacts seated next to them. If we go to less physical distancing than 3 feet, we may see 6 or 8 close contacts just in the classroom setup. Okay. And if classrooms mix, we could see more. This is going to make that increased mixing is going to make contact tracing really hard for schools. And doubt about close contacts could lead to quarantining potential close contacts. So that could also increase the number of close contacts per positive case. Students with symptoms associated with COVID-19, like cold and flu, will also be required to self-isolate for 10 days or get a negative test result that they can show. The nucleic acid amplification test, PCR tests are NAAT tests. There are also some other types, but it'll be that level of proof that will be required to come back if you have symptoms. The unvaccinated siblings of children who are identified with COVID-19 will be required to quarantine for 14 days past their last contact with the kid that was contagious. So if you live in a household where you can't isolate your kids from one another, that child who's positive will be contagious for 10 days. And that means that the siblings could be out for 24 days. So really lengthy absences. Because a COVID-19 diagnosis would also result in any unvaccinated member of a household having to quarantine, many parents may choose to resist getting tested, not wanting to get that positive diagnosis. Extended absences for quarantine and isolation are likely to compound all of the negative effects that we've seen from distance learning over this last year. All of the academic, physical, social, emotional, mental health concerns, all of those things. With greatest impacts most likely for kids that have been historically underserved are students of color, English learners, students with disabilities, foster youth, homeless kids, and students that live in economic hardship. Our pre-pandemic responses for kids that are absent are really likely to fall short. Just giving makeup assignments or assigning them to a short-term independent study contract, which places the burden on the parent to provide instruction, is going to fail to provide meaningful learning and engagement for those kids. So we need something better. Lengthy absences are also likely to challenge families.
We had a couple questions and comments.
Sure.
Is that okay?
Okay.
Jan, did you want to go first?
One of them is, I think what we're going to have to do is, since we already bought all the equipment and cameras, if kids are absent, they can then resort to distance learning the way, with a lot better instruction than with papers. So I think most schools have spent a lot of money on, distance learning. So I don't think it will be an issue to go, like if a child is out, they can go on the camera and see the class, But,
yeah, if schools invested in things like OWL cameras,
yes,
and their teachers have become accustomed to engaging students who are distant and present, that would be ideal. In fact, that's one of our recommendations when we get further down the presentation.
Okay, and then my other comment is, since we've been working with SASE now for, I don't know, since the summertime, we have been increasing students in classrooms. I mean, they're not mixing cohorts, right? But they are.
Mhm.
I mean, some classes are at 100% capacity right now, and I'm not seeing any COVID at all. And so I don't really know if what you're saying is really based on science. I'm really concerned that what we're seeing, because we're with a scientific, research group, that we're not really seeing more increased cases of COVID. Actually, we're seeing 0 cases of COVID, and we have more students coming back to campus. So I just really want to make sure, I don't know. I feel like, I don't know. I'm concerned because the science is not saying that there's going to be more cases of COVID with more kids at the school.
I would beg to differ. I think what you're saying is your current experience doesn't lend itself to that. So the public health assumptions and were vetted by Dr. Kelly Motadel, the Chief Child Health Officer for the County of San Diego. Dr. Sayon, I can never say his last name, also with public health, and Dr. Howard Terrace from the UCSD School of Medicine. So the bottom line is, if COVID gets on your campus, then transmission is more likely because kids are seated more closely together. Because you have a system that is designed to identify COVID early, then transmission is less likely and will likely be caught earlier if it is occurring.
I wanted to check the chat. April had a question. Will there be a plan to set up for children to take homework during possible COVID-related absences so that they don't fall behind?
See, and that's, I think, the big problem is, if we only give kids homework and they're out for a week, or they're out for 2 weeks, or they're out for 3 or 4 weeks, they're not going to be able to keep up. What they really need is to be taught by a teacher during those periods of time. So when we get to the recommendations, we'll talk more about so each of the recommendations responds to these assumptions.
There's no more questions in the chat.
Okay. So with kids being out, somebody has to take care of them, and that is really going to stretch the ability of parents to provide care and supervision for their kids. Parents, including school employees, may be required to miss work to care for their children while they're excluded from school, and that could cause negative financial impacts for families, like lost wages, increased childcare costs, and potentially even job loss if employers aren't willing to be flexible with them. Absences due to quarantine and self-isolation are also likely to impede access to free and reduced meals for students. So we'll talk more about what we recommend for schools in terms of that. As I just mentioned, being away to care for children could result in absences. So it's likely that we're going to see demand for substitutes remain high, and sub shortages probably are likely. Very likely we're going to see what we have seen during this distance learning period is that some people have found that distance learning works better for them, works better for their kids. Not all of the experience has been negative. And there are also people who are just not ready to have their kids come back to in-person. They're worried about it. So very likely there will be increased demand for a virtual learning option for students. Many school systems will substitute that traditional independent study contract with parents providing instruction as opposed to teachers providing virtual instruction. And some well-meaning parents, many well-meaning parents, may mistakenly enroll their kids in independent study programs because of their experience with virtual learning. Some children enrolled in these programs won't be able to keep up. They won't be capable. The parents may be not able to support that independent study format of learning well, and the kids may not be able to keep up. So that's all of our assumptions. I'm going to go ahead and go through the recommendations because probably they're going to cover some of the things that you're thinking. So the first thing is the more people that are vaccinated, the more resilient your school community will be. So we're recommending that you partner with public health and community stakeholders to provide vaccination clinics for children and families and employees, that you promote vaccine acceptance through identifying trusted messengers. And trusted messengers could be anyone from your coaches, teachers, people that children and parents believe are trustworthy. Those are the people you want promoting vaccine acceptance. And then also promote vaccination for seasonal flu because it looks like COVID as a way to lower the chance that you'll have to miss work. Because fully vaccinated people who aren't experiencing symptoms are not required to stay home after a close contact. Promote vaccination as a way to avoid absences from work or school due to quarantine. Promote them as a way to protect your youth sports program or your band or your dance or your drama programs. Because if there's a positive case and all of the other kids are vaccinated, no one's going to have to stop doing what they're doing for quarantine. And also promote it as a way of ensuring that if there are household members who are over 12 and vaccinated, that they won't be required to quarantine if children who are under 12 in their household are identified with COVID. To ensure that kids who are required to be absent for self-isolation or quarantine keep pace with their classes, maintain or develop the ability to provide virtual instruction for kids who are absent. So the best way is that synchronous instruction where children participate in their own classroom virtually while they're at home. And then maintain the capacity to provide internet-connected devices for kids who need them when they're absent for quarantine or self-isolation. Indoor air quality is going to be hugely important with full classrooms. So optimizing your HVA system to ensure that it provides 4 to 5 complete air exchanges per hour of either fresh air drawn in from the outside or highly filtered air that removes aerosol, that's going to be essential at reducing the possibility of transmission in classrooms. To limit the number of close contacts, potential close contacts with a positive case, continuing to use stable grouping strategies is a good way to prevent mixing. And if you have a case in a classroom, transmission would be limited to that group. Implementing strategies to limit mixing across stable groupings would also be important. And then to make contact tracing as accurate as possible, implementing systems to log where children are and where staff and adults are at any given time and who was close to them will be really important. So logging systems in rooms and offices will be important. On-site symptomatic and asymptomatic testing, having the capacity to implement testing on-site based on what the need is at the time. So if you have a child with symptoms and you can immediately test them before they go home and it's negative, that child can return when they're free of fever for 24 hours and their symptoms have been improving. Requiring them to go somewhere else for the test could mean 3, 4, 5 days of absence before they're able to return. Having the capacity to do broader testing if, for instance, responsive testing, testing the members of a classroom may also be able, if you detect COVID in one child, testing the group may also identify several others and limit the potential for spread. Being able to differentiate who goes to quarantine and who doesn't means we really have to know who's vaccinated. So developing systems, public health is trying to get permission from the state to allow school nurses to access the state's immunization database so that you could know if a child is identified as close contact, if they've been vaccinated or not. But you may also want to ask that question and get records when children enroll. And if a parent refuses, they refuse, but at least you know for those who provide it. And then being able to get, because this is a constantly changing thing, you can get vaccinated at any time, allowing people to provide proof on demand if you don't have a record of it already. Continuing to provide access to meals for kids that are absent would be really important. So you want to continue some type of distribution point that doesn't require parents to make repeated trips to school or to mix with children on campus when they come. So being able to pick up either to-go meals, a set of to-go meals, or a box of ingredients would be something, a capacity we want to maintain. Forgive me, I need to cough. Okay. In terms of trying to get the substitutes that we need, one strategy for a school district might be to engage a base number of employees on a daily basis. If we know it's likely we're going to have 6 people in the district out on any given day, or we could follow the trends and increase it at different times of the year, then you've got a ready pool to deploy for critical situations. You might want to explore some type of incentive related to for substitutes who are vaccinated, because they're most likely to be able to come in and keep working. So something like priority assignment or choice of vacancy or things like that. Offering retired employees the opportunity, retired employees who are vaccinated the opportunity to work at an enhanced rate over your sub rate may also get some of those folks back. Maintaining the capacity to maintain or develop the capacity to provide an option for learning at home for families who want it. Like I said before, for some families, they're not ready to have their kids come back to school. For some families, distance learning actually worked better. Their kids learned better. And some families just need it based on their situation. So keeping that capacity, emphasizing direct instruction from a teacher and frequent interaction with a teacher for support, ensuring that the students in this option are getting regular feedback on their progress, and then and giving them the opportunity to move back to in-person instruction at any time if it's not working out for them. All of those things would be advisable. So those are all of the recommendations, assumptions or recommendations that I have for next year. What questions do you have?
And feel free, if you don't want to talk, you're very welcome to put your question in the chat, and then I'll read it out. But don't be shy either way.
Bob, maybe stop sharing so
Okay.
people can see each other.
Or at least their names.
Anyone have any questions? Don't be shy. And just a reminder, everyone is by default on mute. So if you want to unmute yourself, go ahead and do that. We have a question from Anna. What options do families of students with disabilities have for online learning?
Well, so any student that has an individual education plan for special education, their placement has to be determined by an IEP team. So the answer could vary from school or district. The place to start is with your IEP team. And if a family feels that the placement that the IEP team chooses is, if they disagree with that placement, then they should insist that they should basically say they disagree and they should attempt to resolve that issue with the district or the LEA. There are also some due process rights. They can file for due process mediation through the Office of Administrative Counsel.
Are there any other questions? All right, we have one from April. If we send our kids back in the fall and end up changing our minds, will we be able to switch to virtual learning?
Honestly, that answer will vary by school and by school district. Ideally, parents should have, I personally believe that parents should have the option to move their child into in-person learning or into a distance learning option as they need. But capacities in classrooms, so if a classroom is full and you want to go out of distance learning into in-person or the other way around, it might delay that move. So the best thing to do would be to make the decision you feel best fits your child and your family's needs. And then hopefully it does. But if it doesn't, then you would advocate with your district or school leader about that change.
Any other questions? Oh, we have one. Okay, so Catherine said, I missed the beginning of the presentation. Is there an assumption that kids will be required to get the COVID vaccine?
No, I think that's unlikely. Vaccinations in the state have been a really politically charged issue, and it took quite a long time for the legislature to pass laws requiring that students receive the school required vaccination set that there is now. I don't remember them all, but I know like measles, mumps, rubella. The vaccines that are available now are currently authorized under an emergency use authorization. Very likely some of them will receive full authorization soon, but because we've only got vaccinations right now available for 12 and over, and it doesn't seem likely at this point that vaccinations for kids under 12 will be available through the end of the year. And then when they are, they would be an emergency use authorization. I don't think it's going to happen this year that the state would require it. And honestly, I think it would be a huge fight in the legislature if they attempted to require it even for the next school year.
So we have a question from April. Will school staff be required to be vaccinated?
Well, that is actually a question. That really is a question for each employer. It does appear that an employer, not just a school, but any employer, could require their employees to be vaccinated and could require them to tell and provide proof of whether or not they're vaccinated. I don't think, when I talk to school leaders, I don't think that's something that they're excited about, but it definitely is a possibility. With that in mind, there would also have to be provisions that allow people with medical issues or with religious beliefs to be exempted from those requirements.
Hello, my name is Magali. I came in late. What are your suggestions for distancing between students? And are kids going to be required to wear masks?
So I do think the mask question is complicated. I don't think the state is going to require physical distancing. I think they're going to require that schools open at full capacity for anybody who wants in-person instruction. So I don't think that there will be physical distancing in classrooms next year. I do think that masks indoors will be required at a minimum for children who are not vaccinated. The jury is still out on whether or not vaccinated students will be required to wear masks inside. I think it's possible the state may say that it would be allowable for a school to let vaccinated students not wear a mask inside. But from a practical standpoint, that would be very difficult for a school leader to enforce. How would you know out on the playground, or how would you know in the hallways which students have been vaccinated and which haven't? So as a practical standpoint, we may see many schools adopt rules that require all children to wear masks inside. And then if they're allowed to take them off, if the state permits unvaccinated and vaccinated students to go without masks outside, then that might be a possibility. But there's new school guidance that's due out soon. That guidance could change over the summer again. But as it stands, I think it's likely masks will be required inside at a minimum for unvaccinated students.
Thank you.
You're
I
welcome.
have a question, Bob. This is
Mhm.
more of a social issue about high schoolers. You know, we have a K-12, so we have the whole kids, and we're in a low income neighborhood. Anyway, we have found a lot of students in the high school are playing video games, not coming to school. We're doing tons of home visits, getting them to try to come back to school because they're failing. And we don't really have much support from outside. The police say they don't have time for that right now. And, you worked a lot with, truancy and things like this. And we saw a big jump in truancy and at-risk high schoolers. And it doesn't look like, that's why we're not going to allow to have, distance learning next year, unless it's, special circumstances and we can control it. But we've seen a lot of kids are failing. We have to have them go to summer school. And I don't know, it's a big social issue right now. And I don't know what the city or the county can do to help us. We're a small charter school, and we're right now, we deployed everybody today after the staff meeting to go do home visits.
Yeah. Charter schools, because they're single schools mostly, may not be able to provide that distance learning alternative, in which case my hope is that the districts that in those areas are there if parents want to opt for them. Laws on truancy are not real helpful right now. Over the last few years, the legislature has tried to kind of decriminalize truancy. So truancy courts are not allowed to respond to truancy with any type of incarceration in juvenile hall. So a judge can issue an order, a child can basically be in violation of that order, and the judge really doesn't have a lot that they can do. So that really means that we really have to focus on relationships with kids, relationships with parents, responding with interventions, supportive interventions. Truancy is usually not the only issue. Usually there are other causes for that symptom of a problem. So if we can work with parents, work with kids to identify what the root cause is, and then provide intervention, that's our best hope. But as a single charter school, that might make sense to not offer that distance learning option. That would force people who want to remain a part of your school community to choose in person or to move to a school district.
Are there any other questions? Feel free to unmute yourself for those of you who just came in, or you can put your questions in the chat and I'll read those.
For the people who came in late, when I talk about physical distancing, full classrooms, and masks, I am reading the tea leaves. I'm making an educated guess based on the political discussions that we hear about in Sacramento. But the California Department of Public Health has not released their guidance for the next school year. And when they do, it might be different than what I'm predicting. So on that part, these are educated guesses. On the planning assumptions and recommendations, these are things that I'd like you to keep in mind as prudent and reasonable for preparing for next year. And if the assumptions turn out to be not true, it's always easier to do less if you're prepared to do more, but it's very difficult to cycle up after the fact.
So this is Magali again. So for example, if our school requires for every student to wear masks, teachers to wear masks, and then the recommendations are loose and then they can take them off. It'll be easier. Is that what you're saying? Versus telling them don't wear masks and then we force them to wear masks?
Well, I think that would definitely be true. If you let kids go without masks and then decide everybody has to wear them, it'll be a very difficult fight. I think if right now it looks like there will be different requirements for unvaccinated and vaccinated students. And I think from a practical standpoint, that will be very hard for schools to work with. We're also required to protect kids from harassment, intimidation, and discrimination. And if you, for instance, required kids to wear a tag that says they're vaccinated or not, very likely you could have bullying or teachers making decisions and bullying could be on kids who are vaccinated or it could be kids who are not vaccinated. So this is going to be something that would be really hard for school leaders to enforce and protect kids and staff members. So even if the state allows that different treatment for kids who are vaccinated, I don't know that schools may have rules that require more than the state requires.
In any event, for elementary schools and childcare centers, we're not anticipating vaccinations once the school year starts in the fall.
The folks in public health tell us they don't expect them before the end of the year. And in fact, one of the people that said that was, I'm blanking on the doctor's name, but he works with Children's Hospital. He actually was one of your presenters at your first town hall. And also works very closely with the FDA. So he doesn't think that they'll be available before the end of the year, be approved for use before the end of the year. Yes, Dr. Bradley.
Oh, Dr. Bradley, okay. Any other questions, folks? We have okay, so Lindsay asks, if our district decides to set a quote unquote safer class sizes, example, limiting third to fifth grade classes to 30 instead of 36, would the state be able to supersede those sizes and require us to increase class sizes, I guess, for public school?
The state won't say you need to have more kids in the room, but what the state will say is that school districts and charter schools are required to provide in-person learning for everybody who wants it, who's a part of your school. So at that point, it becomes a question of, can you afford more teachers and do you have more classrooms? So if the district were to, from a budget standpoint, say, yes, we're going to set the class sizes at 30, hire additional teachers to cover any students that we can't fit at 30, and we have the rooms available at each school site to do it, then they could do that. Went to Arizona on vacation, came back with a cold. Tested negative, by the way. I did take a test.
These are great questions. Let's have some more.
Yeah.
What's on your mind? Bob's an amazing resource. He knows the answers. So ask what's on your mind.
I had a question, Bob.
Sure.
The public health folks that you folks are working with, do they have any models about what the COVID situation may look like in fall versus winter versus spring for the next school year?
No, not really. I mean, they expect that there could be seasonal spikes. You know, it wouldn't be, we saw a huge spike during when we didn't have people who were vaccinated from Halloween basically through just a week after New Year's. It would make sense that as people congregate and come into close contact, that unvaccinated people would be more vulnerable in those settings. And people are sick and tired of masks and take them off whenever they can. So we may see more transmission occurring at that time. It seems reasonable.
We had a question from Lindsay. Will UCSD SASE be coming back to our sites next year as part of ramped up testing? So for that, the SASE pilot, and Laura and Carissa, feel free to jump in for this, but it will not be, if it does occur, it will not be in the same manner as what we were doing for this school year. If we do, we're waiting for grant funding decision, hopefully coming up pretty soon. But if we do get funded to expand the SASE project, it'll be to help schools build the infrastructure to be able to do responsive testing. Right, Chris? Right, Laura? Correct me if I'm saying something wrong.
Yeah, so with the new grant, we're hoping that, so for now, SASE's been going to your school sites to conduct responsive testing. So with the new grant, the difference would be that we'll still be tracking the environmental results for you and having that readily available for you. But the responsive testing will be taken care of by somebody from the school district who will be trained by us to do responsive testing, and we'll be funding that. So hopefully we get the grant, and we'll keep you all in the loop, and we'll know more in a bit, so we can share that soon.
In terms of the recommendation, SASE is an ideal solution. You don't waste tests unnecessarily. There's no surveillance other than waste and surface. And if you detect it, then you go to responsive testing. It's ideal. You would have to wait. If you don't do that, you would basically have to wait until a child has symptoms, and then they've had a minimum of 2 days of exposing other people. So it's a great solution. I hope the grant's funded.
Hello, I have a question. What if they find COVID in a classroom next year? What is going to be the recommendation? Like if they find it in the teacher versus 1 or 2 students, do you know what the recommendation would be next year?
So the non-SASE answer is they would identify close contacts. Actually, they would with SASE as well, but they would identify people who have been in close contact. So they've been within 6 feet for more than 15 minutes in a 24-hour period. And then they would also identify the people who may have been and they're not sure. And then all of those people who have not been vaccinated would be required to quarantine for 14 days. When you're required to quarantine, you cannot test out of it because you can develop, the virus can basically emerge at any point during those 14 days. So you basically are stuck waiting to see if symptoms develop. So a test at 5 to 7 days is most likely to pick it up. If it's present, that's usually when it's there, but you're still stuck in quarantine for the full time. Actually, there's a 10-day option if the person can self-monitor for symptoms, continue to be 6 feet from all other people, and doesn't develop symptoms for days 11 through 14. So anyhow, contact tracing is the response. Ideally, if a school has the capacity to do responsive testing, they could also test other folks that are close by and see if there are any other people who have COVID. And then if somebody has symptoms, ideally the school could provide a test to see if it's cold or flu, if it's COVID, and if not, it's likely cold or flu. There's also very likely there will be a rapid PCR test available soon. And we're hoping to see those deployed in schools in addition to antigen tests, which are very inexpensive and can give you a pretty good result. But if you, for instance, if you use an antigen test on a person who has symptoms and it's positive, then they're positive. If it's negative, you still need a PCR test. So having that rapid PCR test available on campus would be awesome too.
So usually elementary school, they just stay with their teacher, with their cohort.
Mhm.
But in middle school and in high school, kids rotate.
Yeah,
Right?
yeah.
So they would basically have to be tested all as a unit, or?
So that's why contact tracing is very difficult in middle schools and high schools. So, and why I'm recommending that there be really strong logging systems to record who was sitting where at what time. So if a child in first period if one child in first period is positive, then who are the close contacts in first period? And when that kid goes to their second period class, who are the close contacts there? And then in the third class, who are the close contacts there? So, and with very little physical distancing, that could be 6 or 8 or 9 kids in each class. And the other problem is, if we don't do a good job of contact tracing, it could be all 6 of that kid's classes.
Okay. Oh, okay. So thank you for telling me that. So our kids, my middle school kids go from class to class. If we assign them to sit close by, then we can track them. They can have their same neighbors as they're going from class to class.
Yeah, I mean, in a middle school, if they can create villages within the school so that kids stay with their cohort and they just change teachers,
Yeah,
and they stick with the same teacher, that's an ideal strategy, but it doesn't always work out. In 6th grade, it's pretty easy to do. In 7th and 8th grade, where there may be advanced math classes, and sometimes it's a little harder to do that.
So our kids travel together,
Mm-hmm.
and they go to different teachers. But what I'm saying is, we can have them sit their neighbors, the same neighbors around, so that way
Yeah.
they can. Okay.
Yeah, if you maintain the same seating chart in every class, so then that would be ideal. Then you'd be keeping the same close contacts in each period.
Okay, so then not that many people would be tested and so forth. Okay, thank you.
You're welcome.
So we have a question or a comment. Let's see. It has been difficult to have my high school student take College Board testing this year, both finding testing sites and information. How will these testing opportunities change or improve next year in districts or countywide?
I think very likely they'll be widely available next year. And the best thing a parent can do to ensure that their child has access to them is get them vaccinated, because fully vaccinated people are about 90. The most recent study released by the CDC on healthcare workers showed that the Moderna and Pfizer vaccines are both about 91% effective at preventing people from even getting COVID, and close to 100% at preventing any kind of hospitalization. So a fully vaccinated high school student is very unlikely to get COVID, will not have to quarantine following close contact, would only be required to self-isolate if they have symptoms, and then a positive test puts them back in school really quickly. So I do think testing, college testing, advanced placement, SAT, ACT, I think all of those things will be widely available next year.
I have a question. You said that schools can legally have staff get vaccines. Did you vent this by an attorney, or does our school have to do that?
Well, so the answer is yes and yes. So SDCOE's general counsel has advised us that an employer could require vaccinations with exceptions for people with medical concerns or religious or strongly held religious beliefs, but you should never do anything legal like that without consulting with your attorney.
All right, any other questions? We've reached 7:02. So if there's any other last minute questions, please feel free either put it in the chat or unmute yourself and just ask.
I am also, if I said something and later on you're thinking, Bob, that was crazy, and you want to send me a question, you're welcome to do it. COVID is my primary responsibility for the County Office of Education. So if you think of something later, I'm happy to answer your questions.
Is there a contact email or a contact phone number you prefer? Okay.
I can put my email in the chat, and that's probably the best way because then I know what you're looking for. So let me go ahead and put that in for you right now.
And then what I can do is tomorrow or later this week, I can do a follow-up email with everybody, and I'll put your contact info in there.
Okay, and just for the recording, it's B as in Bob, MUELLER @SDCOE.net.
Awesome. Well, thank you so much, Bob. I really appreciate your time. And everyone, I really appreciate all the great questions. These have been fantastic.
Really good questions. Thank you.
So this is our third and final SASE Town Hall on these specific topics. So thank you to everyone who's participated. I will, once we've recorded this, we will send this out to everyone in case you want to be able to share the YouTube link to be able to share with friends or family who have questions and whatnot. So thank you, everyone, and please have a safe and lovely evening.
Thank you, everyone. Bye-bye.